Hello. Today we are going to cover the Fertility Awareness Method. This is a method that is incredibly helpful to utilize with your clients to, one, help them understand their cycle in particular, but two, to allow them to be more involved in their fertility as well as just their hormonal ebbs and flows throughout the month. It's a great way for them to learn more about their body and to educate them about how it actually works, because let's be honest, a lot of females are not the most educated throughout school on how their reproductive health works. A lot of the times we go on birth control because we are paranoid that we can get pregnant at any time during the month, and that is just not the case. So our job as coaches is not to tell them what is right or wrong, not even to tell them what is the right option for them, but to make sure that they have all the information so that they can make an informed decision and feel confident in whatever they believe is the best for their body. There are many, many women who are well suited, and birth control is just the best option to give them the highest quality of life. And there are other women who might just not know what their other options are. So the Fertility Awareness Method is a method of tracking their cycle. This will allow them to understand better how their body in particular responds to their monthly, and also to give you the ability to see if there's any way to improve the quality of life. Estrogen dominance is something that we talk about as coaches often because there are a lot of women who struggle with this, whether this is truly high estrogen or high estrogen in comparison to the low progesterone they are experiencing. What this involves is tracking multiple things, and there are apps that we can use. I would love for people to share the apps that they have their clients use. I just recommend Natural Cycles for mine, but I have heard of many others that are great, and I would love to know opinions on people who have maybe used multiple. The first thing that we want our clients to track, and this is going to be for people who maybe want to use pen and paper, because luckily these apps usually have you track all of these things and ask the questions so you don't have to remember. First thing we want to track is the length of the cycle from day one of bleed to the last day before the next bleed. Is it consistent? Is it 24 to 26 days? Or are they going 19 days, 50 days, 30 days, 40 days, and it's kind of a guessing game for them? We really want a consistent cycle. So that's the first thing we want to track. From there, the second thing, we really want them to pay attention to how their body feels and what symptoms they have come up during that. Are they experiencing a lot of those PMS symptoms of breast tenderness, mood swings, fatigue, acne, painful cramping, whatever it may be? Have them note that and see how consistent that is. Also, how heavy their flow is. From there, we also want to pay attention to the length of bleed. Am I bleeding for a day? Am I bleeding for 7 days? Is that consistent? Or am I also guessing how long misflow is going to stick around with me? After that, it gets a little bit more in depth. We want to track what's known as basal body temperature. This essentially is the temperature that you are when you are freshly waking up out of bed. So typically you're supposed to take this temperature first thing in the morning before feet even hit the ground. You want to track this because around ovulation, when progesterone gets to be the star of the show, we have about a 0.5 degree temperature spike, and it will hold that 0.5 degree through the entirety that progesterone gets to be elevated. So this gives us an idea on if they are ovulating or not. There are other things we can do as well, such as LH tests, which coincide with that kind of ovulation. And this just allows them to further dial into whether or not they are truly ovulating, which lets them know when they are fertile and when to be careful with intercourse and when they are not fertile. Other things we can check are cervical mucus. This is going to change dependent on where you are in cycle. So if they notice things shifting from more of an egg white-like texture coming out a little bit more frequently, this can give you an idea on where they are in their cycle, but also where their hormones are at. Using the app is really great on any of the apps because it is a lot more user-friendly for them to keep track of. They can set reminders up, and it can even remind them when their cycle is coming. Now, once again, your job as a coach is not to tell them anything other than what is within your scope of practice. Obviously, functional medicine practitioners and registered dietitians and coaches all have different forms of their scope. I am going to be speaking to the lowest common denominator since that seems to be the safest thing for me to do. As you go and you collect this, once again, you should use this as data to, one, understand if there is any way that you can improve their quality of life in regards to their cycle. If they are somebody who is not on birth control or is on birth control and are experiencing really big symptoms around their cycle, you might want to dig in with them to understand how that they can improve that. If they are somebody who is a little bit nervous to go off of birth control but really wants to, they're just concerned about the fertility, great, amazing opportunity for you to explain the different ways that they can be cautious and understand and work with their body to not get pregnant or conceive, and how they can work with their body if they are trying to conceive in order to make it a little bit less stressful for them. So Fertility Awareness Method, I recommend doing it with any client who is not on birth control, just because, once again, our job as coaches in this space is to make them feel as in touch and aware with their body as possible. And for females, there are a lot of us who definitely feel that shift from luteal to follicular to ovulation to menstruation. And so if they can have the knowledge and the empowerment to understand what's normal, what's not, and how to best support my body, they're probably going to see the best results, not just with their physique and with their health, but just with their quality of life in general.